Welcome back to my video series about safe sterilization work practice. I'm Justine Enriquez and we are now on the last part of reprocessing cycle, storing of packaged sterile instruments. Once dirty instruments have gone through cleaning, inspection, packaging, and sterilizing process, they are ready to be stored here in Sterile Services Department, or to be sent back to departments and wards for storage or usage. The sterile storage area is the area in the hospital designed for storage of medical devices and supplies. As sterile technician, we start by washing our hands to prevent the spread of germs, especially when handling sterile items. It is important to wear clean scrubs and hats. We then unload the batch from the autoclave machine. Always remember to use gloves when using a manual trolley as the manifolds are very hot. Chemical indicators must be recorded if cycle has passed or not. Same goes for the spore tests. If any of these tests fails, then all items from the last negative test must be recalled. We then scan the load to approve the batch and check if correct parameters are met. Instrument sets and other reusable medical devices must remain on the sterilizing trolley until adequate cool-down time and can be handled safely by the operator. Also, it is vital not to touch instruments before cooled, as packages still contain significant amount of moisture after being exposed to steam. The moist area can draw bacteria from our hands into the package and would compromise its sterility. A minimum cooling time of 30 minutes is recommended. After cool down, sterile technicians should make sure their hands are clean and dry before handling the items. We should check if sterilizing seals are intact and not broken. We must confirm that the color of the seals and tapes have changed in color. Wrapped instruments should be inspected if wrapping paper has loosened from sterilizing, or if it is wet from the moisture buildup. Check if any sterilizing pouches are torn or have holes in them. These instruments are considered contaminated and needs to be reprocessed. We then continue by scanning to dispatch area and scan to respective departments where the instruments and sets will go. Here is the plastic set that I've just dispatched and inspected for sterility by checking the color change on the seals. Instrument sets and single items are then sorted. Some items are stored in Sterile Services Department, but most are sent back to the other departments and wards to be stored. Sterile products must be maintained and stored in a way that sterility is maintained until items are used. And that's all for safe sterilization practice. Thank you for watching.